So for next surgical option, which we'll be talking about, is what is known as a vaginal hysterectomy. So let's define the terminologies. Hysterectomy just have to do with, I'm trying to remove somebody's uterus. Do you understand? I'm removing somebody's uterus. Vaginal just simply means I was removing the uterus, but I access the uterus through the vagina. I can access the uterus through the stomach. Do you understand? So, and through the stomach, I might want to open wide, or I might just want to open small space. So it's just a type of what? Uterus surgery, okay, done through the vagina. So, this is what? Through the vagina, right? This is through the stomach. So we're talking about this one of through the vagina, So it's also a surgical technique. This is where the uterus is removed, is through the vagina, right? So I might choose to remove only the uterus, or I might choose to remove the uterus, the fallopian tube, and the ovaries. You get? So this is without any external abdominal incision, all right? So I'm using only the vagina. I'm not cutting the person through the stomach. Of course, many people prefer this one that is through the vagina, because it will reduce all those complications that have to do with healing, wound care, infections, if I'm supposed to cut the person that large on the stomach to access the uterus. So it's often preferred, yes, in treating benign gynecological conditions. This is because I'm just going to the vagina is an opening, all right? So the time that it takes the woman to heal up is lower than me creating an opening through the stomach. So it's commonly used to treat things like what? There's uterine fibroids have caused so much pain and bleeding to the woman. If the woman has been bleeding so heavy, okay, uterine prolapse, adenomyosis, chronic pelvic pain, early stage gynecologic cancers. So surgical technique, they can just give you some 1 or 2 anesthesia, just to numb the vaginal area. Right, so the surgeon makes some little incisions just to increase the size of the vagina just a bit. The uterus is detached from the surrounding structures, ovaries, fallopian tube, ligament. Now it's removed through the vagina. All right, absorbable tissue sutures will now be used to close any opening that were made. So advantages: there's no abdominal incision, there's a faster recovery, there's less pain after the operation, there's shorter hospital stays, and the cost is lower. Okay, so that's just it for the vaginal hysterectomy.